I am Ramona and welcome to Ramona Interviews. And with me in the chair today is Dr. Jennifer Lish. Welcome, Jennifer.
Thank you.
Just introduce yourself briefly and then let's get into those examples.
Okay, I'm Dr. Jennifer Lish. I'm from the Worcester Center for Cognitive Behavior Therapy, which is at 9 Cedar Street in Worcester. And we specialize in the treatment of psychiatric illnesses, emotional disorders with cognitive behavior therapy.
And what's your website?
It's www.worcestercognitivebehaviortherapy.com.
Let's dive into those examples.
Okay.
What's our first example today?
Okay, I think our first example today should be a 7-year-old boy who had previously had a normal, varied diet. And his family knew that he had a peanut allergy because he had had anaphylactic shock, a bad reaction to a food containing a peanut product when he was an infant. And then he had had no experiences of that until he was 8 years old. And then he accidentally ingested a small amount of a peanut product. And, a normal, effective, healthy response to that would be going forward to avoid peanut products. Allergists told the family was that the young man should avoid ingesting peanut products in order not to have an anaphylactic shock reaction again, an allergic reaction to the peanuts. But this child developed an anxiety disorder, a phobia, or you could call it obsessive-compulsive disorder, OCD. He avoided really essentially almost any food. He started eating very little and eating very few foods, eating only a very small quantity of a very small number of safe foods, and also restricted where he would eat, the circumstances where he would eat, to the point where he was really only able to eat about 750 calories a day of certain very specific limited foods, and only if his mother was nearby. So understandably, this child lost weight, dropped on the growth charts. Kids are supposed to track a certain percentile. If you're 50th percentile for height and weight, you're supposed to pretty much stick to that throughout your childhood in order to grow in a healthy way. This child's pediatrician sent up a red flag when the child was at 18th percentile for weight and 35th percentile for height. So the child had a phobia, irrational avoidance of things that were not dangerous, like eating at school, eating products and eating foods that didn't have peanuts in them, and so on. So what we needed to do was to form a team, an alliance of the child, the school, the parents, and myself, the therapist, against the phobia. So first we have to conceptualize and get the child to conceptualize the phobia as something apart from himself, as an enemy. And we use age-appropriate terms. We help this boy to think of the phobia as like a bully, like something that was trying to boss him around, and talk to him about not being scared of it, about it being a trick, about it being like a broken fire alarm, about it being like a false smoke alarm. When I cook lamb chops, my smoke alarm goes off in my house. That's because I'm not such a hot cook, and I burned the lamb chop, and there was a little smoke. But there isn't a fire. The house is not burning down.
So what's appropriate?
So
what's an appropriate response?
What's an appropriate response? So we helped him and his parents to ally together against the phobia, and then we had him do exactly what he had been afraid of doing and avoiding doing. Namely, I had in my office a whole bunch of different foods, and we ate all those foods together. We went step by step. We ate first foods that he was not very afraid of, and then we progressed to foods that were completely novel to him, completely strange to him, and his mother was out of the room, and he was not able to ask me extensive questions and seek a lot of reassurance about what the ingredients were and what were in foods. He was simply told that none of the foods contained peanuts, and then he bravely ate all these different, I got the weirdest foods you can imagine, things that most adults never eat, all kinds of exotic stuff. And we ate like crazy, rapidly, recklessly, in my office. And his homework was to take a bag with him every time he came. He and his parents would take the bag home, and he would eat those brave foods at home. And he really got into it. And he started saying, "Daddy, please pack some brave foods in my school, in my lunch today for school."
Yeah.
And he quite rapidly overcame that. It was really great to see this kid who looked skeletal, looked skin and bonesy, start to look hearty again. He started gaining back weight and eating wherever he needed to eat, ate at restaurants, ate with no parent around, ate at the school, gained weight, started growing again.
So everything became more in proportion, more appropriate to, so it didn't take away his peanut allergy, it simply allowed him to associate what needed to be where it needed to be.
Right.
As opposed to dragging that into other things.
Right. We helped him to discriminate what was truly dangerous, namely peanuts, from what was risky, but not extremely risky. In life, we cannot avoid risk. There's no way to live with no risk. You and I are both here today because we came in cars. We wore our seat belts, we didn't speed, we weren't drunk, but we drove cars, and motor vehicle accidents can always happen. In life, our kids need to go out and take risks. We want to push them out of the nest. We want our baby birds to go fly. They might fall. The only way to keep them safe is to keep them at home under the covers. And that's no kind of life for a kid or a teenager, and that isn't even safe. So everybody has to undertake risk in daily life. There's no life worth living that doesn't entail risk. Anything could have peanut on it, but we eat anyway, even if we have a peanut allergy. So the treatment for anxiety disorders, the cognitive behavior therapy treatment, is to conceptualize clearly what is dangerous, what is not too dangerous, what entails some risk but not an outrageous amount, and then to do those things that entail some risk but are worth it for the benefit. www.worcestercognitivebehaviortherapy.com, and through there you can access a lot of good resources for the treatment of anxiety disorders in children, teenagers, and adults.
I am Ramona, and thank you for watching Ramona Interviews. Have a wonderful week.